Good afternoon, and welcome to the Institute of Strategic Policy Solutions nonprofit program on how our nonprofits are stepping into the gap of services during this trying time with COVID-19. My name is Kimberly Jackson, and I am the Executive Director of the Institute for Strategic Policy Solutions. And I thank you for sharing your time today. And I want to thank my panel in advance for giving us their time when they have to help so many others during this very challenging time in all of our lives. Before we begin, I'd like to talk a little bit about what the Institute is, also known as ISPS. ISPS is the brainchild of Congressman Bill Young. Congressman Bill Young sought to educate our community at the local, regional, state, and national level on the scope of government. It was his vision to create a think tank that provided a forum for nonpartisan discussion on social, political, and economic issues. For more information on our institute and how we're serving the community, please go to our website at www.facebook.com/SPCIS/PS and/or solutions.spcollege.edu. We invite you to learn more about our program, and we invite you also to share your feedback. I would like to talk a little bit as we move forward with the program about our speakers. Our first panelist is Jennifer Yeagley. Jennifer is a Tampa Bay-based nonprofit executive with 20 years of organizational and community leadership experience. She served most recently as the Vice President for Administrative and Strategic Operations for Gulf Coast Jewish Family and Community Services. Over her 2 decades in a range of executive roles, she has served the Florida community and several other states. Jennifer recently joined the executive director of St. Pete Free Clinic, and with compassion and respect, the St. Petersburg Free Clinic will continue to change lives by providing food, shelter, and healthcare to our neighbors in need. Next, we have David Jazik, the president and CEO of the YMCA of the greater St. Petersburg area. David has a successful 37-year professional career at the Y, and began his early years with the Y as an athletic, social, and being involved with the youth. He's a proud Texas Tech University graduate and has utilized his mastery of physical education along with his affinity for helping others to serve multiple people and in multiple roles in the YMCA. We're so glad to have you today. Our next panelist, Duggan Cooley, is the CEO of the Pinellas Community Foundation. And the PCF wants everyone to know that they're doing their best to serve the community during this time. He's served in this role since 2016 and this PCF has 50 years of community experience and seeks to provide effective solutions for our community's most challenging social, environmental, and educational issues while supporting the advancement of arts and culture. Through PCF, more than 260 charitable organizations have received $57 million in donor-funded grants to support their community programs. And last but certainly not least is Beth Houghton. Beth serves as the CEO of the Pinellas Juvenile Welfare Board, which is a special taxing district dedicated to the well-being of our children and families. She has been engaged in the Pinellas community for over 30 years in healthcare, homelessness, food, insecurity, and children's services. Again, I want to thank you for your time today as you begin sharing the important work that the community is doing. For our audience, right now we'll begin with Jennifer, but at the bottom of your screen is a Q&A. The Q&A allows you to ask any questions you want of our panelists. We would ask that if you have a specific question towards an agency, that you would put the @ symbol with their name so it goes forward with them. And if not, if it's to all the panelists, just simply state it's to all the panelists. Again, we'll do our best to answer all these questions as we move forward. With that, I would like to begin with Jennifer. And Jennifer, thank you in advance for your time.
Thank you so much, Kimberly, for pulling this together today and for giving me the opportunity to share a little bit about what the St. Petersburg Free Clinic is doing at this really challenging time in our community as we respond to the crisis around COVID-19. As Kimberly mentioned, the St. Pete Free Clinic helps our neighbors in need with food, shelter, and healthcare. And we are certainly seeing a lot of increased need in all of those areas. We operate what we call our We Help Food Pantry for Pinellas County residents, and as I'm sure many of you, may have experienced or certainly seeing coverage around the nation about the absolute increased demand for food in all of our communities and the importance that food banks are playing right now in making sure that people do not go hungry. We have seen that increase here in Pinellas County. For some context, during the first week of March, for example, in We Help, we served about 700 households. During the first week of April, we served over 1,400. So just at our food pantry, we have seen the need double, and we know that food insecurity remains a serious and vital concern. And we want to be sure that everybody tuning in today knows that we are here, we are available, and you are welcome to come visit us and to receive the food that we are distributing. We're able to increase what we have done in large part because of the support from a couple of my co-panelists here, the Pinellas Community Foundation and the JWB, lots of other generous supporters who are gravely concerned about food insecurity and want to make sure that we can continue to reach people, families and children and seniors with food. And so that has been an enormous part of our response to COVID-19. We also continue to distribute out of our food bank food to 60 partners throughout Pinellas County who operate food pantries at their locations. And that's everything from the Florida Dream Center to faith institutions and other neighborhood-based organizations where you can also access food if that's something that you need. We have a health center that serves individuals who are uninsured with primary care services. And because of the many primary care organizations or primary care clinics having to shut down to keep folks safe during COVID, we have also had to discontinue seeing patients on site, but have moved to a telehealth model where we are able to serve existing patients by phone so we can continue to refill their prescriptions, answer questions, and provide education. And in a moment, I'll talk a bit about health resources in the community that you can access if that's something you need between now and the time that we're able to reopen and accept new patients. We also, in the meantime, are continuing to post our informative health education videos on Facebook Live and on YouTube, so you can find us there for those purposes. And we operate 3 shelters, a family residence, a men's residence, and a women's residence. We have isolation plans prepared because, as you can imagine, in a shelter environment, it's a grave for everybody there, staff and residents included, if somebody becomes ill. And so our biggest priority at this time is to make sure that we keep people healthy so that we don't have spread of virus within that shelter where a lot of folks at once get sick. We have suspended intakes at this time for that reason, but we will be bringing more people into those shelters. That need is going to increase as we have a little bit more sense of or control over COVID in our communities. So please do stay tuned there. And we have really benefited from new volunteers wanting to be supportive and to help out during this really difficult time. We have onboarded about 40 new volunteers, which is a really remarkable outpouring of support, and we're so thankful for them, especially at this time when the need is so high. So I want to share the address of our We Help Food Pantry, which is at 863 3rd Avenue North here in, sorry, I see that I'll try to speak up. So our We Help Food Pantry is downtown, 863 3rd Avenue North. You do have to be a Pinellas County resident to access that service, and services are provided 1 time per month. And you can see the hours of operation hopefully on your screen from 8:30 a.m. to 3 p.m. on Mondays and Tuesdays. And then on Thursdays, we're open longer, 8:30 a.m. to 7 p.m. So anybody can come see us. There is no income requirement. You don't have to prove anything. If you are hungry, you can show up and you'll be served. Because we are also very concerned about schools being out and students not necessarily benefiting from the free breakfast and lunch programs at schools, and we know that that's going to be indefinite, that our schools are closed. We want to be flexible and be able to provide meals to children. We again, are benefiting from the support of the JWB for some extra help in that program so that we can provide what we call our pack-a-sack meals to children, which ordinarily would go in a backpack and go home with kids on Friday. So they'd have those over the course of the weekend. But again, because school's out, we can't operate in that way. So instead, we've partnered with the Y, which we're really grateful to David and his team for allowing us to set up every other Wednesday at Childs Park YMCA. The address is on your screen, 691 43rd Street South. And the dates are there as well. So we've already done one mobile distribution of pack-a-sacks. We'll be there again on April 22nd, on May 6th, and again on May 20th from 10:30 a.m. until 12 p.m. We're also looking to add new dates and additional sites. And so please do continue to check our website and our Facebook page, which you'll see there at the bottom of your screen, for additional mobile distribution sites and hours, because again, it's really important that we're able to get food to folks who need it and to be as flexible and neighborhood-based as we can. Please know too that we're going to post information about how to access our health and dental center services when our clinics are able to reopen. So we're prepared to meet that need. And then finally, if there is a need for shelter, as the immediate threat of COVID-19 passes, we look forward to doing intakes and meeting that need. So we'll post that information on our website and on Facebook as well. I want to share some additional helpful resources at this time, not provided by the free clinic, but related to food and healthcare. So here you'll see where you can access SNAP benefits, which is the Supplemental Nutrition Assistance Program. It's a state-run program for individuals who are food insecure. The website is there. You can certainly Google it as well. And you'll note that there was a work requirement put in place for folks to access SNAP, and that has now been lifted. So if you are working but meet income requirements, you can still access this program if that's something that you need. There are qualifications, but I'd encourage anybody to look into that if that's a need. There's also the WIC program, which is a supplemental nutrition program for women, infants, and children. Some of the criteria are listed here on this slide, but you do have to be either pregnant or a woman who's recently been pregnant, breastfeeding, and meet certain income guidelines, be a Florida resident, and have a nutrition-related need. And so the number for WIC is here on the screen. You can also access it at the link provided. And please note that this information is going to be posted on the ISPS website after this. And so you'll be able to access these slides and these links when the presentation is complete. If you have an emergency dental health need during the time that our clinic is closed, I'd encourage you to get in touch with the Pinellas County Department of Health. The link is there on the screen. Again, it will be available after this. And there's also a phone number you can call where you can ask specifically for dental services and be pointed in the right direction. If you have any emergency medical services that you need, as always, call 911 first, and that's the best way for somebody to point you in the right direction of what the best thing for you to do is, depending on what that need is that you have. If you have any COVID-19 questions, Baycare is operating a 24/7 nurse triage line. It's 1-800-BAYCARE. You can call that if you have questions or concerns that are COVID related, and they are there to staff that and to point you in the right direction there as well. And finally, Baycare has a really robust and helpful coronavirus response community resources page where you can find everything from food and nutrition information about government and social services, resources for seniors. The link is there on the screen. And if you're looking for additional COVID-related resources, the Pinellas County Health Department also has those on their website. So you can access that website. You can email covid19@floridahealth.gov or call the number on the screen. So in addition to what the free clinic is doing, there are a number of community resources in the way of health, food that you can also access. And again, all of that information is going to be posted after this. And thank you so much for giving me the chance to talk a little bit about those resources.
That was wonderful, Jennifer. Thank you very much. We next have David with the YMCA, who's going to share a lot about what we're doing with the community and particularly for our youth and seniors. Thank you, David.
Thank you, Kim. I'm honored to be among such a distinguished group of panelists, and thank you for including me. As you may know, the YMCA here in St. Pete, we enjoy a strong partnership with our neighboring Ys, the YMCA of the Suncoast and the Tampa Metropolitan Area YMCA. And as the crisis began to increase, our conversations became more frequent as the Y had to make a decision as to whether we were going to open. And we know that if one of us closed, we would probably all have to close. So on March the 17th, we simultaneously announced that we would close all of our YMCAs and pivot and repurpose our existing facilities to provide childcare for essential personnel in our community. It was time for us to take care of those that were taking care of us. Today concludes our 4th week of the YMCA Youth Relief Care for Essential Workers program. Here in St. Pete, we're hosting 3 sites, the Jim and Heather Gills YMCA, the Bardmore Y, and the YMCA at Lellman Exchange. This week, we served just over 170 children. Across Tampa Bay, we're at 21 sites and serving collectively over 700. At RY, we are providing care for ages 5 through 12 at a cost of $50 per week, with the program starting at 7 a.m. And concluding at 6 p.m., Monday through Friday. Our website here, you'll see a listing of all the essential workers that qualify and can register online. This week, the Early Learning Coalition of Pinellas County announced that they were removing the income qualifier for families of first responders and emergency medical personnel. So if you know of anyone out there that qualifies in that, certainly you can direct them directly to the Early Learning Coalition's website. I believe we have that up on the next screen. While transitioning our membership facilities to meet the critical needs of our community, we were encouraged by our members who are staying with us and continue to pay their monthly dues. We're very pleased with that response, and it's allowed us to pivot in this direction. I'd like to share a short video that shares a message that went to our members and our donors to share a little bit about what the impact we're making.
Hi, I'm David Jezik, President and CEO for the YMCA of Greater St. Petersburg. Just as many of you are answering the call in our community to help each other through this unprecedented crisis, the YMCA is finding ways to best use our resources, and we are working hard to keep our community strong. For those of you who have answered the call to stay with us as we navigate critical change in service to meet the needs of our community, we cannot thank you enough. The gift of your membership dues at this critical time, as well as significant support from community partners like Florida Blue and others, is allowing our youth relief care for families of essential workers to thrive. Medical personnel, first responders, grocery workers, truck drivers, elderly care nurses, delivery service workers, and many others. While we are unable to serve you in our branches directly as mandated by our government leaders, our staff is working hard to support those on the front line that continue to care for us. Here is just a sampling of the positive impact you are making by staying with us at the Y. Thank you.
My name is Kelly. I'm a nurse anesthetist, and the reason this camp is very good for me is that I have a reliable place to take my children when I'm trying to get to work to help my patients. And childcare is one of the biggest stressors in my life, and this camp has really saved me of having to stress out about a situation that I can't control right now.
My name is Ashley Tilka. I work at the Florida Department of Law Enforcement in Tampa. It's important for us to have care at the Y this week during this tough time, because otherwise I wouldn't be able to provide the services for our state and our counties that I have to, regardless of whatever catastrophe is going on at the time. We're always deployed, and we're always ready to serve our communities. So without this care, I wouldn't be able to perform the essential duties that I do on a daily basis.
It really was a blessing, honestly, to have this childcare. It gave me a lot of peace of mind for childcare for my children in a safe and healthy environment that I'm already comfortable with. My son goes to the preschool here. We've been here, and we come to the summer camp program here as well. So it's very important for me to have the childcare so that I can continue to work to support my family and to help support the people as well.
My mom and dad are physical therapists, and since they're working, I get to come here and make new friends and play with my friends. My mom works in the ER, and since she works in the ER, I get to come here and play basketball, do arts and crafts, and play soccer, and I get to have fun here.
Say thank you very much for your generosity. It has helped with the financial impact that we have on this. Coming at the last minute with no child care and then having to pay out of pocket, sometimes worrying if I was going to work full shifts, but now that I am, it's great to have this coverage and the help.
Oh, I'm very thankful because very, very much needed, and very thankful for everything that has been donated.
I can't say enough to the members and donors for not only helping facilitate this, but for also reducing the cost for us, as our pay doesn't go up for this. So the fact that the cost did go down significantly, having multiple children here, it is a huge asset to be able to not have to come out of pocket even extra money that we weren't planning on during this hard time.
So you probably saw a lot of hand cleaning. There's a lot of hand washing. Obviously, when the children come to us, we check temperatures and we clean between stations as groups move through the YMCA's. Ratio 1 to 9. Obviously, we're practicing social distancing as much as we can, but kids are be kids, right? In addition to our youth relief care, our 3 preschool academies are open, and we're serving over 200 children, which is about 70% occupancy for us right now. So there's still families out there that are having to work. Our efforts directly associated with responding to this crisis also, as Jennifer shared, we're partnering with the St. Petersburg Free Clinic, providing a site distribution at the Child's Park YMCA. And Jennifer may not know this, but right about an hour before our first food delivery, we did a robocall to about 400 families that were a part of our YMCA Neighbor to Neighbor Christmas program. And we do that quite often. We communicate with them about opportunities. So that may be why we had over 150 families show up. It was kind of a surprise for the staff there, but we know that they are accustomed to hearing from us, and certainly giving them direction was important. We're also partnering with One Blood today as we Zoom. I believe right now, well, actually in 8 minutes, we're going to be giving blood at 7 YMCAs across Tampa Bay. So at the Jim and Heather Gills Y and the Bardmore YMCA, we'll be collecting blood. We're also reaching out to our seniors every day. We're calling over 100. We have a pretty large population of silver sneakers that participate in the Y, so we want to make sure that we're checking in and make sure they're doing well. We're doing well checks basically with each of them. We have over 900 members that have signed up online for less meals, so there's a website or a link on our website that you can actually go on and take classes. I want to encourage you to browse that and see if you find something that might be of interest. Our dance academy, our youth dance academy, is registered over 200 for continued practices and lessons as they prepare for their recital later this fall. Our literacy program, Y Reads, we're tutoring over 100 children virtually, and we're also working with the children at the youth relief care program. As you may be aware, Pinellas County School District is requiring 90 minutes a day of online schooling. So we're working with the students throughout the day. No doubt this has been a trying time for us as the Ys had to close and pivot. We obviously lost a significant amount of our revenue, and we had to furlough over 400 employees. I am happy to announce that we did receive approval of the Paycheck Protection Program, so we hope to get many of those workers back employed and back engaged with us as we embark on this journey ahead. In closing, I'd like to thank the Juvenile Welfare Board for continuing to fund many of our grants as we've gone through this. Obviously, the United Way has stepped up. The Tampa Bay Rays, Florida Blue gave us $100,000 to support our Essential Cares program across Tampa Bay, and many other donors, as well as our members. That's pretty important to understand. We actually have people that have joined the Y, even though they can't use it to work out, just to support what we're doing. We're very appreciative of that. Obviously, this is an important year for us. On May 1st is our 100th anniversary. I don't know how we're going to celebrate, but we'll have to do it virtual, but we're going to continue to work toward recovery and for another 100 years of service. Thank you for allowing me to participate.
Thank you, David. We appreciate all that you're doing for the community and for your partnerships. Duggan, I'd like to turn to you because I know that you have a different focus, as does Beth. So with that, I'll have you go ahead and start so we can get to our panelists' questions. Thank you, Duggan, for your time.
Thank you very much. I appreciate being on the panel this morning and being able to share the work of Pinellas Community Foundation And first, I'd like to say how proud I am to be a part of our community. The response and the outpouring of support, the volunteerism, even though for some people that is not safe. Our organizations are pivoting, finding ways to redeploy volunteers and staff in safe manners. And I'm very proud of that. I'm proud of those organizations, and it makes me proud to be a Pinellas County resident. Our focus at the foundation has been on forging partnerships for resiliency. What we have done in this period of time, at the end of late March, we formalized a partnership that is now known as the Tampa Bay Funders Community Response Collaborative. And we worked closely to do that with the United Way Suncoast, Allegheny Franciscan Ministries, and the Foundation for a Healthy St. Petersburg. We wanted to formalize those relationships. We all work well together, and we support projects jointly with one another. But we wanted to formalize a way that we can communicate with each other and respond when our community needs our help the most. One of the early projects of that community response collaborative was creating the Tampa Bay Resiliency Fund. And the Tampa Bay Resiliency Fund is up and running now, and I'll talk about that in just a minute. But the purpose of our community response collaborative is to convene our funders, to pool resources with one another, and streamline our response to crisis and community problems like disasters and the pandemic that we are experiencing right now. As I said, one of the early projects that we have is the Tampa Bay Resiliency Fund. And the goal of that fund is to respond to catastrophic events in Tampa Bay. We have a very special focus on making sure that our funds reach the most vulnerable in our community, as defined by both race and socioeconomic status. We have also agreed that funds from the Tampa Bay Resiliency Fund will be used in a response that's evidence informed. And so for us, in this current issue, this public health crisis, we are responding based on information, knowledge, and data that is coming from our public health officials as to community needs and issues and how to respond safely. The priorities of the Tampa Bay Resiliency Fund are protection of life, mitigation of harm, and strengthening our nonprofits. And to provide some examples, so protection of human life, helping to provide services like emergency food, shelter, and other basic needs, access to healthcare services for the uninsured or the underinsured, mitigation of additional harm, helping to strengthen community information systems during this crisis, things like placing a priority on bilingual information delivery, helping to increase our health system capacity by providing alternative quarantine locations would be an example of mitigation of additional harm, and then strengthening our nonprofits related to their critical intervention and services to the community in this time. Things like technology and other resources to help an organization pivot and change the way that they deliver service. And the reason that we have focused on resiliency as such an important part of this fund is not only do we want investments that we make right now to help with today's issues, but to help our organizations better respond in the future and respond in a way that's stronger. And so there's a significant focus on resiliency. I need to go back a slide, I think. The address for organizations to figure out and for the public to donate is at our website, pinellascf.org/TBRF. An organization that is looking to augment its activities in the community would be able to go there. There is a button to apply. It runs through all of the eligibility criteria so that an organization can know if they're eligible or not. Not only are we supporting 501c3s, but we are supporting other 501cs that are doing the work of 501c3s, that charitable work, governmental entities as well. All of them qualify in the general qualification criteria for the Tampa Bay Resiliency Fund. Our collective partners have already raised over $1 million for this fund. The donations continue to come in. We live in a very generous community and that is very responsive in times of disaster like we're experiencing today. And again, I'm proud to be a part of a community that is so giving. A couple other things that the foundation is doing. Not only do we have our partnership working on the Tampa Bay Resiliency Fund, at the end of March, beginning of April, in concert with about 13 other organizations, there was launched the Pinellas Arts Community Relief Fund, providing financial support to artists and arts organizations. As many know, like all kinds of businesses across our community, work has stopped. And so there's no concerts to go to. Our usual entertainment venues aren't selling tickets, we can't enjoy the arts and the culture that make our community so vibrant. And those organizations help to stand up an arts community relief fund. Just yesterday, checks went out to over 100 different artists in our community who have received support from that particular fund, financial support. And then, as many know, the city of St. Petersburg launched their Fighting Chance Fund, a way to help small businesses and those affected by COVID-19 closures. And then the city worked with Pinellas Community Foundation to start a charitable support fund that will augment the second phase of that project. And so private support is coming into the foundation for benefit of the city's Fighting Chance program. That information is available on our website as well. Not only how to donate to that, but then it connects you directly to the city's pages to find out if your business is in the St. Petersburg area and how it qualifies. So all of these funds are working in concert with a number of partners across the community, strengthening our partnerships and helping us become a more resilient community. And I cannot tell you how proud I am to work not only with the other panelists that are here today, but with many, many nonprofit organizations that are invested in the health and resiliency of our community. It's refreshing to see that in the face of such a crisis.
Thank you. It is exactly that, refreshing to see that all these organizations are doing the same thing, but they're doing it together, and it strengthens our community. I want to remind our audience that you can start loading questions into the Q&A. We have one last panelist, Beth, and as soon as she is done, we will start answering the questions. If there are questions that you again have to a specific panelist, kindly send it to them and they will answer the questions and type the answer in directly. All right, Beth, you're at the end. Thank you so much.
Thank you. Well, it's quite a group to be following. The first thing I would want to say, mirroring a little bit about what from Duggan's comments, is I continue to be, and we continue to be, just amazed at the agility and the immediate responsiveness of the nonprofits in our area to the needs of those they serve. And I think you've heard perfect examples of that from David at the YMCA and for Jennifer at St. Pete Free Clinic. They had to quit doing some of the things they were doing very quickly because they weren't safe or appropriate, but they looked at ways in which they could serve their community and are doing that in very important ways. So the Pinellas Juvenile Welfare Board focuses on the well-being of children and families, and we fund over 50 agencies with about 82 different programs. So first, we immediately pivoted to making sure we could support those agencies as they go about their work. And included in those are the YMCA and St. Pete Free Clinic and many others. And so a few of the ways that we were able to do that, which really reflects the foresight of people who were there before I was, is that by policy, the Juvenile Welfare Board provides continuation funding for our agencies through a state of emergency for if they've had to close or all or part of their funded programs. And so we can't make up revenue that they might have lost in other ways, but we can continue to fund expenditures that they continue to have in the programs that we contract with them for, even if they've had to close those programs or substantially change those programs. That's meant a great deal, particularly to some smaller organizations who really rely upon the Juvenile Welfare Board. And besides the fact that that means that those employees can remain employed, it also means that those organizations are intact to be ready to go when things begin to open up. And that's one of our current concerns, is not only how are we going to get through this period of time, but how is everybody going to be at the end of this to be able to respond to community needs and their own missions after all of this. So some of the other ways we've tried to support our agencies has been to be flexible with our funding. And so for many, they've needed to they submit budgets to us and we support those budgets, but they've needed to be flexible and move money from this place to that place. Or personnel have been, we funded personnel to do certain functions and those functions aren't going on anymore, but others have spiked and they need to be able to move that. So we've tried to say, to process those things really quickly and say yes, as long as those things made sense in the current environment. And it again speaks to the flexibility and the thinking outside the box that so many of our agencies already do. We sometimes give them ideas and prompt them, but they're doing it mostly on their own, and we're just trying to support them. We've also been a hub for information, both within our funded agencies and across the community. That would be especially true with regard to childhood hunger, where we've kept up with who's providing food to whom and when. And so I would say our website is, there are a lot of places you can find this information. I know our people are working really hard to keep ours very up to date, and it has been changing rapidly and will continue to change. So it's everything from the school system to other efforts that we have on our website under the COVID tab relative to childhood hunger. We've also added funding in some key areas, and so we've used our contingency fund of about $500,000 to fund emerging and spiking needs, and you've heard what some of those are. The biggest and most immediate is food, and food for children and families. And so we've worked with both our neighborhood family centers to make sure that we doubled up on the food that they give out to their neighborhoods, often neighborhoods where people don't have cars and don't have transportation. In addition, we've provided $200,000 and then another $100,000 to 4 major food hubs across the county, who then push that food out to smaller organizations. So those include the Shepherd Center in Tarpon Springs, RCS in Clearwater, the Dream Center in Lillman, and St. Pete Free Clinic in St. Petersburg. And the Free Clinic has been willing to be sort of the purchasing agent for the last 100,000 of bulk food purchases, something they do particularly well, and they share very well. And so they will purchase what is available and what's cost effective and what is needed in the current environment by food banks and food pantries. Many of you may have heard there is a lot of produce available, but there are other gaps in what's available. So we really had the perfect storm of needs increasing in the food arena at the same time that all of us were going to the grocery store and taking things off the shelves. And so the grocery stores were not delivering food, or we were not able to pick up food. Our food banks were not able to. And that provides a significant amount of the meat and bread and other things that the food banks rely on. So you had increased demand and decreased supply all at the same time. So we've tried to fill a little of that gap with our funding. Additionally, we supported one of our mental health agencies as they moved to telehealth. And there's one of the questions that came in was, what about mental health services? And I would tell you that all of the major mental health agencies, Directions for Living, PIMS, the Suncoast Center, are all working on an almost entirely virtual basis, but for the few areas where they have to see people face to face for injectable drugs, for instance, things like that. But they very quickly pivoted to that. So for those who need mental health services, you can go to those agencies who have always been there for us for mental health needs. So we helped provide an extra server and licensing for Zoom and all that kind of stuff, so that Directions could move from 20% of its employee base being able to do that to all of them being able to do that just almost overnight. We've also assisted, had a unique opportunity, as we know, during difficult times, recession, and certainly this particular time when you not only have heightened anxiety, worry, and isolation in the home, that you can expect domestic violence to increase. There's no doubt that it is already increased, and the calls are just beginning to increase, but we know that's just the beginning. Because the victims are not out and about at school or other places to be seen by others, there's probably a lot that is going on that nobody else yet knows about, but that's going to happen. So CASA had a 7-plex that had been out of service for a period of time due to lack of operational funding. And then they had a grant to begin in October, but in the meantime, it was sitting not really habitable, but otherwise available. And so we stepped in and not only funded to clean up, repair, replace appliances, that sort of thing, but also actually managed the project, because everybody at CASA was up to here in taking care of the needs they had on a daily basis. So they have just begun to be able to move families in there. And that does two things. One, it means that they had already sort of decompressed their shelter to allow more social distancing, where they typically have people doubled up. So just at the time when an increased need occurred, they would have less capacity for admitting new individuals or families. So this allows them a place to isolate folks who may test positive or may be showing symptoms. And it also just expands total capacity for them. So they've, I think, raided their thrift store, gotten furniture and other things, and are beginning to open up those rooms. The last thing relative to the work of the JWB is that we have for many years had a family service initiative, which is the ability for individuals who are facing temporary issues with payment of rent or utilities or other things to call 211. Those calls are then screened and sent over to the JWB and to 2 agencies who work with us to case manage and support those families. And needless to say, those calls have gone up tremendously, as we expected. So before they began going up, we moved people around at every part of that so that we would be ready to take on the onslaught of calls. And it would not be a surprise that in the first days of April, we helped twice as many people with rent as we did in the full month of April a year before. So much like Jennifer's reporting relative to the need for food, we're seeing that need for paying rent and utilities and those sorts of things to increase. There's one other resource I'd like to make sure people know about. Directions for Living has an emotional support call line. It's not mental health. It's not a 211 for specific things. It's a warm voice to talk to. And I believe the way it typically works is you leave your name and somebody will call you back, and they're doing that. And that phone number, and it is a 727 number, is 524-4454, extension 1001. So it's 524-4454, extension 1001. You don't have to be a client of Directions. You don't have to become a client of Directions. You just want somebody to talk to and to talk through the fears or the anxieties or that you have. And that's a terrific service that Directions put together very quickly to serve our community. So I continue to be incredibly impressed with our nonprofit organizations and their ability to be incredibly responsive and prompt about meeting the needs in our community. And the Juvenile Welfare Board is proud to be some part of that.
Thank you, Beth. It's really important that we share these resources today. You all said a lot, and I want to make sure that our audience knows that all of this information will be on solutions.spcollege.edu, which is the ISPS website. We will have all the panelists' presentations, along with the numbers, because there were several numbers that were put out there related to daycare and mental health and just supports in general, and how you access funds from the different partners. So with that, we're going to start some of the Q&A, and we want to be mindful of everyone's time. And again, know that you can reach out, and we will continue to have these questions answered. I'm not going to use any names as I go through the questions, but here we go. And if it's directed to a specific panelist, I'll try, but if not, we'll just all answer them. For the first question, is there a list of Pinellas resources that all of you have talked about here and others that I can easily share with my clients and families, grants, mental health, and food banks? I don't know if we can answer that succinctly, but if you all know of a shared resource, instead of going to your individual websites, do you have one?
I think I would continue to suggest if folks are reaching out for resources, one of the best aggregators of that in our community is our 211 Tampa Bay Cares, and dialing 211 from a phone in Pinellas County is a great way to reach out for those resources, and then to also look at the ISPS website, which will have all the links from today too.
And to Duggan's point, the 211 website is a great way to see those resources and not have to wait on a phone call.
The next question is to all panelists. Are there any agencies providing emergency assistance for rent or utilities, and are there any open shelters?
I'll start with that. The county is providing some funding for rent and utilities, and the portal to get to that is to call 211. And for families and for families with children, the same portal would be the case, and that's 211 and the Family Service Initiative of the JWB. Now, there are a number of other agencies that are also providing that assistance, so some of the other panelists might want to add to that.
Jennifer, I know that we have shelters, but the shelters are closed at this time, correct?
They are at this time. So in terms of the emergency funding for utilities and rent is something that the free clinic is able to provide under normal circumstances. Because we have had to shift all of our operations to the food pantry, we actually aren't currently set up to be able to provide that assistance in this moment, but we anticipate in the coming week or two that we can reinitiate some of that and are going to keep the community posted on our capability to provide that service again. So that's one small resource there that we're hoping to reinitiate. In terms of shelters, that's right. Our shelters, we are not currently doing intakes, but I would recommend calling the Homeless Leadership Alliance of Pinellas County. That number is 727-582-7916, and the website is pinellashomeless.org. It's actually a really good resource also. There's not a listing on the website of open shelters, but a call to them I think would be the best way to understand, because many shelters are being very careful about new intakes because of the enormous concern of the spread of the virus and wanting to keep everyone as safe as possible. So we're all sort of in the same boat of needing to provide that housing, but wanting to protect our current residents. And so that's the best way to find existing current resources. There's also a listing on that website homepage of every single meal break spot that Pinellas County Schools is operating for the pack-a-sack type meals. And so it's an extensive list of all the different schools that are distributing food, along with the days and times that that's happening. And so that's in addition, we're only providing right now one small distribution of that with more to come. But that website, as does the Pinellas County Schools, has a really thorough listing of where folks can access that.
Okay. I'd like to go on to another question. Is anyone focused on assistance to the immigrant community? They often have no benefits from their jobs and will not be eligible for any of the funds coming from the government. These are the people that are often that often care for our basic needs, like picking of our crops, cleaning facilities, and working in the kitchens of our restaurants.
I think
anyone who can
one
answer
of
that
the Yes, I think one of the best organizations designed to respond to that would be the Intercultural Advocacy Institute in our community, which operates our Hispanic Outreach Center. They're headquartered in Clearwater, but have locations elsewhere. They're very much in touch with resources, programs, services that may be available to help our immigrant community, documented or undocumented, and finding the right resources to meet their needs.
Okay. We have one other question that I want to get to, but it's more of a statement, which I think we can address though. This comes from one of our participants who is concerned about advocacy with the legislature and what we're doing about that. As there are critical budget decisions in the next 2 to 3 months, what are we doing to advocate for funding for maternal health and early care and needs that have to be supported? Can any of you all answer that?
I can just say we're actually in touch with our local officials who, some of whom have proactively reached out to us because they want to find out what we're doing, what other, resources in the community are doing, and importantly, how they can help. So I'll say that I know that a number of our legislators and public officials have been engaged in the conversation and want to find the ways that they can best get information to their constituents, but also how they can help remove barriers so that we can provide more services, particularly at this time. And so I think there's a recognition that there is going to be not just the need to meet these emergency and critical services right now, but we are looking at a longer horizon of needs that are going to be there for folks who were experiencing poverty before this, and certainly those who were one paycheck away from financial catastrophe and have now lost their jobs. So there does seem to be recognition of that and an engagement with the community to figure out how we can work together to put solutions in place.
Yeah, Kim,
go ahead, David. Thank you.
From the WISE perspective, we have a Y Alliance across the state of Florida, and of course there's 33 alliances across the country, and then we have a national organization that is doing a lot in DC in terms of advocating for legislation. I know that I've sent a number of letters off. We've got this system that fires off an automatic letter to everybody that needs to get it with advocating. So I know that, in fact, if you didn't hear, they're indicating today in the paper that the funds have been all used up for the PPP. So now there's a push for more funding, and then there's a whole nother set of relief that's in the works that we've been advocating for the larger nonprofits that were not included in this first round.
Okay, well, I'd like to make another just comment, sort of shared information that we got in the Q&A. We have, of course, some really well-known contributors to the community, and one is the Urban League, and the Pinellas County Urban League provides utility payments in addition to online applications for assistance, and they served over 5,000 customers last year. So, one thing that I like to talk about the Institute is we're not here just to share the information. We're also here to make sure that it becomes real for you and you access the information, because it's important that with all of these resources, it doesn't matter if we're not using them as a community and we don't know where to go or which community is the best community organization to address the needs of your family, your business, your home, or your peers. So that was one of the most important part of making sure that you all have this information. There's another question. I've heard multiple times from constituents that Urban League, this is a question that I will have the Urban League follow up, because this was a question for the Urban League and this was not on our panel, but thank you. I'll make sure this question is provided. We are getting close to the end, so I want to make sure that you all know to go to our website to get all of this information at solutions.spcollege.edu. I do want to ask one other question to the panelists about volunteers. I know that all of you all have methods and ways for people to volunteer. Are there specific criteria in light of this COVID-19 virus that might be limiting your ability to take on volunteers?
I'll jump in on that. So we are About 83% of our volunteers who actually help on a day-to-day basis in our We Help Food Pantry are over the age of 60. So pretty early on, we wanted, our volunteers to be safe, to stay safe at home. And what we're experiencing now is, folks in those older age groups and those who have underlying medical conditions, we need them to be safe and healthy. And so we're asking that everybody, in those categories does stay safe at home for now. But we are allowing and accepting, new volunteers, certainly because we have that need. And anybody who's interested can access that information on our website. And we look forward to, the capability to engage the whole community as soon as it's safe to do that. But we are certainly still taking volunteers and do have that need.
Okay. Well, if there's no other responses, I'd like you all to just do a brief last statement before we sign off. And since Jennifer, you started, we'll let you be the last, and we'll start with David and move on to Duggan, then Beth, and then back to you, Jennifer.
Thank you, Kim. I tell you, I really enjoyed this, and I just wanted to share a quick story. A few weeks back, I got a call from an owner of a restaurant that was looking to make a donation of food, and that's not in our wheelhouse at the Y. We don't do food delivery, and we're not a food bank. And my first thought was the St. Petersburg Free Clinic. Jennifer and I have never met, so I emailed her randomly, and on a Saturday morning we're talking, and I connected her with someone that wished to give away a bunch of fresh produce, and I understand that maybe 2 days later or 3 days later it was delivered. So, from all this, we're making new friends, and we're learning how to work together and staying in our lane as to what we best are fit for. And so for me, right now at the Y, we're doing essential care. We're making access to food through our partners, and then also ensuring that we have ample blood supply. So that's our trifecta: food, blood, and essential care.
Thank you, David. Duggan.
I just want to reiterate how proud I am to be a part of such a giving and generous community. The outpouring of support that we've seen has been incredible. Watching organizations forge new relationships, build stronger relationships, and respond to new needs in our community. Their ability to pivot so quickly, to be innovative in how they deliver services has been incredible to see, and it's been incredible to experience as well. And from Pinellas Community Foundation's perspective, we are in this with all of those organizations. We're in it with all of our funders. We will come out of this better and stronger because we're all working together.
Thank you so much. Beth?
One of the things that has struck me is that for the federal government to move very quickly, or the state government to move very quickly, is just hard. And I'm not going to get into politics, but those are just big ships to turn and to create assistance quickly for people. So just this week, people are beginning to receive stimulus checks the Congress passed to approve that, 3 to 4 weeks ago at least. What the nonprofit community in the local area has done is immediately rush into the fray and provided things. A need is talked about on a Monday and it's being filled on Tuesday or Wednesday. So I think it's pretty impressive that the local community has pulled in, even though they don't have the huge resources that the federal and the state government has. To your point about advocacy, I certainly hope that both the federal government, through things like the PPP or others, or the state government, will recognize that nonprofit infrastructure is going to need some support because it's poured everything it has into meeting this need and meeting the needs in front of them. So in paralleling Duggan's comment, I'm incredibly proud to be a part of Pinellas County and to see the ways in which the individuals here, as well as the organizations here, have pulled together. but I'm also aware that we haven't met all the needs, and we've still got a lot of frustrated people who aren't getting what they need today. And we're pedaling as fast as we can to help that.
Thank you, Beth. And Jennifer, any final parting words?
I would just, remind the community that we're seeing a lot of folks who are accessing our services that have never had to go somewhere to receive services before. We want everybody to know that that is okay. We welcome anyone who needs us, no questions asked. We're in a really difficult time as a community, and we really have to pull together to work to meet one another's needs. And I just want to say thank you so much to the outpouring of support that not just the Free Clinic has received, but our partner organizations, our funding partners, that it has been a significant outpouring, and it is taking all of that support to meet this critical need right now and going forward. So thank you.
Yes. And we have other people on the line, and I am going to use her name because she offered a wonderful service. This is Jennifer Sunshine. She is the CSBG Program Director for Pinellas Opportunity Council. Her agency offers assistance for rental, mortgage, and utility assistance. And I have sent that to our team, and we will make sure that that is also included on our resource page. And with that, I'd like to just say thank you again. Thank you, Jennifer, David, Duggan, and Beth, for quickly getting this together. I sort of just called them and say, hey, we need to do this. And thankfully, they all agreed. And I think it's important that the community knows. And so this is going to be recorded, and afterwards our link will be available for us and on the respective websites to share, to just get the information or to go to our website. So ISPS thanks you, and we appreciate your time. And before we part, I'd like to thank again our ISPS team, Jacqueline Shuett and Sharon Panov. I'd also like to thank all the supportive members of the respective agencies who jumped in to help. And I don't want to leave names off, so I won't start with names, but everyone has a team, and everyone's team is what makes us all work together. So thank you